What is acute leukemia? Leukemia is a cancer of blood-forming cells. To understand this type of cancer, let's look at how blood cells develop. All the cells in our bodies start as stem cells. They're made in the bone marrow, the spongy material in the center of most of our bones. Stem cells are very basic cells that grow and develop so they can do specific jobs. They can become blood cells, or muscle cells, or nerve cells, or any other type of cell. There are two types of stem cells that make blood cells. One is called myeloid, and the other is called lymphoid. In the first step of blood cell formation, stem cells develop into blast cells, or just blasts. Blast cells then develop into different types of blood cells. Blasts from myeloid stem cells will become red blood cells, platelets, or different types of white blood cells. Red blood cells carry oxygen to tissues all over the body. Platelets help blood to clot. The different types of white blood cells help fight infection and destroy abnormal cells, including cancer cells. Blasts from lymphoid stem cells will develop into just one type of white blood cell, called a lymphocyte. Leukemia is when blood cells don't form and behave normally. There are many types of leukemia. They are named based on the type of blood cell that is abnormal and how quickly the leukemia develops. Acute leukemias develop very quickly. The blast cells don't mature into healthy blood cells. They make many copies of themselves, which build up in the bone marrow. As more and more abnormal blast cells build up, they crowd out healthy blood cells, so they can't do their jobs properly. There are two main types of acute leukemia. Acute myeloid leukemia, or AML, develops most often in adults, but it sometimes affects children. Acute lymphoblastic leukemia, or ALL, is the most common type of leukemia diagnosed in children. Only a small number of adults are diagnosed with ALL each year. Acute leukemia can make people very sick. They may have a fever, find it hard to breathe, and will be very tired. They may also bleed and get infections easily. Leukemia is usually diagnosed using simple blood tests. The healthcare team may then do a bone marrow biopsy to look at the type and number of abnormal cells in the blood and bone marrow. All of this information tells the team what type of leukemia it is and how best to treat it. If you have an acute leukemia, you will need to be treated right away. Chemotherapy is the main type of treatment for acute leukemias. Your healthcare team can give you more information about acute leukemia and your treatment options. The Canadian Cancer Society is also here to help. Visit cancer.ca or call us at 1-888-939-3333.